If you're a man over 60, then please listen very carefully, because what I'm about to share with you may completely transform the way you experience intimacy, connection, and pleasure for the rest of your life. Too many men reach their later years believing the best moments of passion are already behind them, thinking aging automatically means weaker performance, lower confidence, and less satisfaction for both partners. But the truth is far more inspiring. In fact, many men discover that their most fulfilling, powerful, and emotionally bonded intimate experiences begin after 60, not before it. And today, I want to reveal something that almost no one is talking about, something that can change everything. There is a hidden pleasure zone inside the male body that 99% of men either don't know about or misunderstand. And once you understand how it works, it can dramatically strengthen your performance, increase sensitivity, boost confidence, and even improve prostate health. This isn't theory, and it's not fantasy. It's real anatomical science that every man deserves to know. So stay with me until the very end, because knowing this one piece of information could be the key to unlocking a healthier, more powerful, intimate life, no matter your age. Now let's begin by clearing up the biggest misconception. When men hear the term G-spot, they automatically assume it refers to women only. Most men don't know that the male body has a corresponding structure, sometimes called the male G-spot, located inside the pelvis. And this area is not just about pleasure. Supporting it, stimulating it, and keeping it healthy plays a crucial role in urinary function, prostate wellness, blood flow, erectile strength, and full-body relaxation. It's scientifically connected to the same nerves involved in climax intensity, pelvic floor muscle control, and deep involuntary muscle contraction. So understanding this area is not about being adventurous. It is fundamentally about improving health and restoring confidence. So what exactly is this hidden spot? Anatomically, it's the prostate gland. The prostate sits just beneath the bladder, surrounding the urethra like a ring. It's about the size of a walnut in a healthy younger man and a little larger in men after 50. While most people think of the prostate only in the context of health problems, like enlargement, urinary difficulty, or cancer, very few realize that the prostate is one of the most nerve-rich organs in the entire male body. It contains dense bundles of sensory nerves connected to the pelvic plexus, an area sometimes referred to as the pleasure motherboard. When these nerves are activated in a healthy way, it can dramatically enhance performance, sensation, and control. That's why men who learn how to care for, massage, or therapeutically stimulate the prostate, either medically, through physical therapy, or through safe techniques at home, often report experiencing more powerful blood flow, stronger and longer-lasting erections, and significantly more intense climax responses. But here's the surprising part. Most men have never once experienced their prostate in a relaxed, healthy, activated state. Why? Because tension in the pelvic floor, inflammation, chronic sitting, and age-related muscle tightness can restrict blood flow and compress the nerves that supply this area. Many men feel the consequences as weak erections, difficulty starting urination, dribbling after they finish, reduced pleasure, premature fatigue, or a sense of numbness rather than deep sensation. These are not signs of failure. These are simply signals from your body saying, I need attention, I am capable of more. When the prostate becomes activated in a healthy, therapeutic way, something amazing happens. Blood flow increases, pelvic muscles relax, tension releases, and the nervous system sends stronger pleasure signals. That's why many doctors, urologists, and pelvic floor therapists recommend prostate massage or stimulation, not just for enjoyment, but as a medical support tool. Research shows that it can help improve erectile function, reduce inflammation, promote better urinary control, improve circulation, and assist in clearing fluid buildup inside the gland. Many men describe the experience as more intense, deeper, longer, and more emotionally connected than anything they've felt previously. So when we talk about the hidden G-spot location that 99% of men miss, we're talking about the prostate, an organ that, when properly cared for and supported, may dramatically transform your intimate experiences and your overall health. And no, this is not something strange or unusual. It is a completely natural, biological part of your body designed with extraordinary sensitivity and purpose. Men throughout history, from ancient Asia to modern clinical therapy, have practiced prostate-based health techniques to enhance vitality and longevity. Before we go further, let me address an important point with respect and clarity. Many men feel uncomfortable, nervous, or embarrassed discussing prostate stimulation or massage because it's not something we grew up learning about. For decades, male health has been reduced to silence or jokes, while women have openly studied and celebrated anatomy and pleasure science. Men were taught to simply tough things out, suffer quietly, or pretend nothing was wrong. But ignoring our health doesn't make us stronger. Taking ownership of it does. And learning about your own body is not only normal, it's one of the most powerful steps a man can take to protect his dignity, confidence, and quality of life. The truth is, men over 60 are rediscovering connection, passion, and strength by embracing education rather than fear. You deserve to feel alive again. You deserve to feel confident again. You deserve to enjoy intimacy without anxiety or uncertainty. And none of this requires dangerous pills or surgery. The male G-spot, the prostate, can be supported with natural methods, lifestyle adjustments, safe therapeutic stimulation, and exercises that restore blood flow and nerve sensitivity. So now the big question becomes, where exactly is this hidden spot, and how do you find it safely and effectively? Most men don't realize that the prostate is located only about 2 to 3 inches inside the body, toward the front, behind the pelvic bone. If you place a finger inserted gently and curved slightly upward, you'll feel a small, firm mound, like a rounded walnut. That's the prostate. When it's tender or swollen, it may feel uncomfortable, but when it's healthy and relaxed, applying gentle pressure can trigger warm pulsations, deep, full-body waves, and stronger pelvic contractions. If done correctly, the sensation can build from a subtle warmth to a more powerful response that many men describe as deeper and more fulfilling than typical climax. Some describe it as reaching parts of their body they never knew existed. But before we talk about techniques, we need to talk about health and safety. Many men think more pressure equals more results. It doesn't. The prostate is delicate. It requires slow, patient, thoughtful stimulation and must never be rushed. What matters most for prostate health is blood flow, relaxation of pelvic muscles, and reducing inflammation. That means learning to use breathing, warm-up techniques, pelvic floor stretching, and natural supplements that support circulation and reduce swelling. When the prostate is healthy, everything works better. Intimacy, urination, stamina, and confidence. And I want to emphasize one important truth. Exploring the prostate has absolutely nothing to do with orientation or identity. It is simply anatomy. It is biology. It is a medical and therapeutic practice used by millions of men around the world, recommended by doctors not only for pleasure enhancement but for longevity and prostate care. Choosing wellness is not a statement about who you are. It is a statement that you value your body, your partner, and your future. In Part 2, I'm going to explain exactly how to safely support the prostate for better performance, how to increase blood flow naturally, how to activate the pelvic floor correctly, and how couples can use this knowledge to build deeper connection, trust, and pleasure. We'll also discuss common mistakes men make and how to avoid them. And I'll reveal a few doctor-approved methods that can dramatically improve confidence and sensation, often within just a few weeks. Now that we understand the power and importance of the prostate, the true location of the male G-spot, let's explore how to support it, stimulate it gently and safely, and how to rebuild performance from the inside out. Whether you're single, in a partnership, or beginning a new relationship, this knowledge will help you approach intimacy, not with worry or pressure, but with confidence and excitement. The goal is not to chase performance. The goal is to reconnect with your body in a healthy, deeply satisfying way. The first and most important step in activating the prostate and rebuilding intimate strength is improving blood circulation. Erections are fundamentally a blood flow event. but poor circulation is one of the most common age-related challenges. Sitting for long periods, reduced testosterone, stress, poor sleep, medication side effects, and prostate inflammation all decrease oxygen-rich blood flow to the pelvic area. Without strong circulation, sensitivity drops, stamina weakens, and pleasure becomes muted. But the good news is that the pelvic region responds quickly to rehabilitation. One of the best ways to increase pelvic blood flow is deep diaphragmatic breathing. When you breathe deeply into the belly, you stimulate the pelvic floor muscles and increase oxygen supply to the prostate. Try this simple exercise daily. Sit upright, place one hand on your belly, inhale slowly for 4 seconds, hold for 2, and exhale for 6. Repeat for 3 to 5 minutes. Men who practice this consistently often report improved arousal, stronger contractions, and deeper sensation. That's because breathing relaxes the pelvic floor, which is essential before any prostate stimulation. A tight pelvic floor prevents blood from entering the erectile chambers and makes climax weaker and shorter. Next, let's discuss pelvic floor muscles specifically. Most men think tightening these muscles, often taught as the Kegel exercise, is the key. But actually, many men over 60 already have overly tight pelvic floor muscles without realizing it. Too much tension blocks circulation and can lead to erectile difficulty and urinary problems. So instead of clenching, we need to learn to release. A simple stretch you can try is lying on your back, placing your feet together with your knees open in a butterfly position, and breathing deeply for 3 to 5 minutes. This gently relaxes the pelvic region and opens blood flow. Soft tissue massage around the perineum, the area between the scrotum and anus, can also help release tight muscles and warm up the nerves leading to the prostate. Once the pelvic floor is relaxed, prostate stimulation becomes not only more comfortable, but significantly more effective. Medical prostate massage has been used for decades to reduce inflammation and improve urinary function. It can be performed by a trained therapist, through a doctor, or safely at home with gentle techniques. The safest approach is to start externally, by massaging the perineum with circular motions and light pressure. Many men feel waves of warmth or pulsation as circulation increases. Some men experience pleasurable contractions or a sense of fullness. This is your body waking up. From here, internal stimulation can be explored, slowly and carefully. Using a lubricated gloved finger or a medical-grade prostate massager designed for beginners, gently insert 1 to 2 inches and curl slightly upward toward the belly button. You will feel a small mound, smooth, rounded, and slightly firm. That is the prostate. Instead of pressing hard, simply apply gentle, rhythmic pressure or small circles. Think of it more as listening rather than forcing. At first you may feel nothing. That's normal. It may take a few sessions before nerves fully reconnect. Stay relaxed, breathe deeply, and let sensitivity build naturally. Many men describe the sensation beginning as warmth, then spreading deeper into the pelvis, eventually sending pleasure signals that feel different from traditional stimulation. More internal, more powerful, almost wave-like. Some men report full-body contractions that last longer, stronger, and more controlled. Others say the emotional connection becomes deeper because the experience is calmer, slower, and more intimate. Some describe it as the most intense climax of their life. And for men with erectile difficulty or sensitivity loss, prostate stimulation can create pleasure responses even when traditional stimulation does not. But there are additional benefits beyond pleasure. Prostate activation encourages drainage of trapped fluid inside the gland, improving urinary flow. It increases oxygen delivery to tissues, helping reduce swelling and discomfort. It can help prevent stagnation that leads to inflammation. It strengthens involuntary pelvic contractions, making climax more powerful and less abrupt. And most importantly, it restores confidence, something many men lose silently as they age. Let's talk briefly about couples because, for men in relationships, learning about the prostate can completely transform intimacy. When partners explore this area together with trust, communication, and patience, it opens emotional closeness that many couples haven't felt in years. It turns intimacy into teamwork rather than performance pressure. Instead of worrying about lasting long enough or being hard enough, men can relax and enjoy the connection. That changes everything. But success requires communication. Men need to feel safe sharing what feels good and what doesn't. Partners need reassurance, understanding, and patience. Start slowly. Use touch, massage, breathing, and conversation. Make it an exploration, not a goal. Many couples say it becomes the most bonding experience of their relationship. If you're single, don't worry. This is also an opportunity to reconnect with your own body, rebuild confidence, and enter future relationships from a place of health instead of insecurity. Before we finish, here are a few important safety guidelines. Always use lubrication to prevent irritation, trim nails carefully, avoid force, stop if anything feels sharp or painful, and talk to a doctor if you have active infection, severe swelling, or recent surgery. If you have prostate cancer or are undergoing treatment, consult your urologist before prostate massage. Now let's put everything together into a simple plan that any man over 60 can start today. Step 1. Daily deep breathing to build pelvic circulation. Step 2. Pelvic floor relaxation stretches and warm-up. Step 3. External perineum massage to release tension. Step 4. Gentle internal prostate stimulation using safe tools or a partner. Step 5. Consistency, patience, and no performance pressure. If you commit to this process, you may experience improvements not only in pleasure, but in urinary function, confidence, mood, sleep quality, energy, and overall sense of masculinity. And here is the most important message of all. Intimacy does not end at 60. It evolves, it deepens, it becomes richer and more meaningful. You are not past your prime. You are entering a new one. If you're ready to take back control of your body, your confidence, and your pleasure, start today. Your future self will thank you.